All right, hi, I'm Dr. John Fritch. I'm one of the orthopedic surgeons with OrthoCincy Sports Medicine, and I'm here today to talk about hip injuries, and more specifically, am I a candidate for hip arthroscopy? So just some guidelines for the seminar: that you're all muted. Please type any questions, comments, or technical difficulties in the chat box. We'll answer all the questions at the end. This is being recorded, and you'll receive a follow-up email with a link for the recording in a couple of days. So hopefully you can share those with other people or refer back to it. I don't have any disclosures. So a little outline of what we'll be talking about today. First, we'll be addressing hip labral tears, femoroacetabular impingement, or FAI, which is a mouthful, but we'll go into more detail later, and hip dysplasia. We'll talk about the diagnosis of these injuries. We'll also talk about non-surgical treatment options. And finally, we'll delve into what hip arthroscopy is, what to expect from surgery, and I'll give you a case example of one of my patients. And at the very end, we'll answer any questions you guys have. A brief introduction. First, I want to give a big shout out to my wife. I wouldn't be able to do what I do in a job I love without her constant support through the years. She's truly my better half. She's a Northern Kentucky native and a midwife by trade, and a mother to our two beautiful children. We have a daughter, June, who's now 2.5 years old, and a son, James, that's 3 months old. I've lived in the greater Cincinnati area for the past 11 years. I went to medical school and did my orthopedic surgery residency training at University of Cincinnati, go Bearcats. I spent an additional year of training specializing in minimally invasive arthroscopic techniques, where I'd had a particular interest in hip arthroscopy and preservation. So this first slide, I want to go over some basic hip anatomy so that we can better understand what happens in injury. The hip is a ball and socket joint, where the ball is the femoral head, which is part of your thigh bone, and the socket is the acetabulum, or part of your pelvis. The labrum, which comes up a lot in injury, is a ring of cartilage that forms a gasket around the ball and socket. Just like a gasket, it keeps joint fluid sealed in the joint and provides a suction seal around the ball and socket joint that keeps it stable. Articular cartilage is the smooth finish on the ends of the bone that allows the joint to glide. I alluded to tread on a tire. Just like a tread on the tire, it wears out over time. The capsule is made up of ligaments that surround the joint and provide stability. Both it and the labrum help hold the ball in the socket. And the synovium is the lining of the joint that makes joint fluid, and it gets inflamed when you have these hip injuries and when you have arthritis. Many people may have heard of, known someone that's experienced or personally experienced a labral tear. It's more common in the shoulder, mostly because we've known about it longer in the shoulder than the hip. It happens when the ring of cartilage or gasket around the socket tears off. When that happens, there's a loss of the gasket effect or suction seal, and the joint fluid leaks out. That leads to a loss of stability, an increase in motion in the ball and socket. We call this microinstability. It's called microinstability because your hip doesn't necessarily pop out of the socket, but you see an increase in abnormal motion because of the loss of that suction seal. Over time, that increase in abnormal motion causes hip inflammation and pain. Usually, this is experienced by pain in the groin. Additionally, the torn labrum can flip in and out of the socket, causing mechanical symptoms or locking, catching, or clicking sensation in the hip. So how do labral tears happen? Usually it's due to repetitive motions, such as twisting and pivoting motions at the hip. These can be related to sports or any sort of repetitive activity. You're at increased risk of these labral tears if you have structural abnormalities of your hip. Such abnormalities include femoroacetabular impingement, or FAI, and hip dysplasia. We're going to talk about those in just a minute. Another cause of labral tears is hip dislocations. That's a rarer cause because it's a pretty big mechanism. It requires something like a car accident or big injury. We do think that labral tears may contribute to the development of later hip arthritis, but we haven't been able to prove that yet because we haven't known about hip labral tears long enough to prove a definite link. So that big word, femoroacetabular impingement or FAI, what is it? It's abnormal bony anatomy that may lead to impingement or pinching of the labrum, which causes labral tears over time. A pincer deformity is extra bone on the socket side. I describe it as a little extra awning covering the ball, as you can see in the picture. A cam deformity is extra bone or a bump on the ball side of the ball and socket joint. This leads to a lack of a spherical ball. Either one of these or the combination of both leads to increased pinching of the labrum and tearing over time. Hip dysplasia, on the other hand, is a shallow socket. Most people, well, if you have this, you're born with it. It leads to an increase in abnormal motion of the ball in the socket, because when your socket is less deep, you have more abnormal motion of the ball in there. This is often associated with a loose capsule, which leads to even more abnormal hip motion. Over time, this micromotion leads to hip inflammation and pain in the groin. So, how do we come to a diagnosis of a hip injury? The first part is getting evaluated by a healthcare provider and getting a documented, careful history. A lot of times these injuries can be acute, meaning they could have happened a short time ago. Other times they could be chronic, meaning there's something that built up over time and that gradually and progressively have gotten worse. Additionally, a physical examination is helpful, particularly exam maneuvers that result in hip impingement and pain in certain positions can indicate that you have a labral tear. Additional studies are usually warranted, including x-rays of the hip to take a look at your bony anatomy, to look for the things like we talked about before with the femoroacetabular impingement, the dysplasia with a shallow socket, and also look for arthritis. An MRI is another diagnostic study that we use to take a closer look at the soft tissues. Soft tissues include things like the labrum, the tendons, the cartilage. It's really the MRI where we're able to see the labral tear. This may also be used in combination with a diagnostic injection. What that is an injection of numbing medication into the hip joint. If that injection causes relief of all your symptoms, we know that your pain's coming from the hip joint. And if you have a confirmed labral tear on your MRI, then we know it's coming from your labral tear. The good news is that most hip injuries and labral tears get better without surgery. So at least initially, what we talk about is non-operative treatments. Some of this includes taking a break from the sports or repetitive activities that initially cause the pain. Next, we also usually prescribe anti-inflammatory medications, which act systemically to calm down inflammation and your pain. Additionally, physical therapy can be helpful in getting your hip moving better and strengthening the muscles around your hip to help you compensate for this injury. Lastly, injections may help confirm that the labral tear is causing your pain and hopefully provide some lasting relief. So finally, what is hip arthroscopy or a hip scope? It's a minimally invasive procedure that's performed through 2 to 3 poke hole incisions. Due to the limited trauma, people have faster recovery. We use a camera and various pencil-sized instruments to work inside the hip joint. And with that, we're allowed to address labral tears, as well as address the bony bumps we see with femoroacetabular impingement, or address the shallow socket we see with hip dysplasia. What to expect in surgery? So hip scopes are a same-day procedure, meaning you come and go the same day. It's typically about a 2-hour procedure. At least at the facilities I operate, both at St. Elizabeth and Christ Hospitals, I use a new innovative operating table for accessing the hip joint. Traditionally, this required putting a post in the groin or crotch area to help pull your hip partially out of socket. The problem with that is that it occasionally caused lasting numbness in the peroneal or groin region. This new table, called the Guardian table, relies on friction between your butt and the table to gently pull the hip out of the socket and avoids that numbness. In addition, as part of the surgery, it requires X-ray to help access the hip joint. Once we gain access to your hip joint, we inflate it full of water so that we're better able to see your labral tear and work within the hip. While we're inside the hip, we'll address labral tears and repair them down with things called suture anchors, which essentially drill into the bone of your socket and help tie down those tears. Additionally, we're able to remove any extra bone associated with femoroacetabular impingement. We're also able to address a loose capsule, and we use sutures to tighten up the capsule in cases where we see hip dysplasia. So what to expect after surgery? Usually after surgery, your leg and hip will be numb for 1 to 2 days because of a nerve block that we give preoperatively. That's to help you out with pain. The next thing is that usually the next day after surgery, you can remove your bandages. Because you have very small incisions, you're able to shower the very next day and just keep them covered with Band-Aids. Physical therapy will start on rehabbing your hip beginning a week after surgery. Typically, I keep patients on crutches for about 4 weeks after surgery to help protect their repair while your body heals it. In general, I usually let most of my patients return to full activities and sports after 3 months following their surgery. This is compared to traditional techniques. We used to do these procedures open with a large incision where we had to dislocate the hip. That often resulted in staying in the hospital for several days for recovery and up to a year of recovery. So arthroscopy has really narrowed down, shortened the recovery period. Finally, am I a candidate for hip arthroscopy? Well, in short, if you have groin pain, pain around the hip, locking, catching, clicking around your hip, you should come in to be evaluated by a physician. This may require X-rays, an MRI, and a diagnostic injection to help confirm the diagnosis of a labral tear or these other hip injuries. I think hip arthroscopy is a very reliable procedure for relieving hip pain and allowing for a fast return to an active lifestyle. Here's an example of one of my patients I've recently treated for a labral tear and femoroacetabular impingement. She was a 34-year-old. She had an acute injury while she was trying to catch something. She twisted her hip, ended up falling down on that side, and immediately afterward had pain in her groin, as well as some catching and clicking. We got her started in physical therapy pretty early. However, she wasn't seeing much improvement in her pain. We also had her take anti-inflammatories, which helped a little with the pain, but didn't completely resolve it. As you can see on here, we obtained an MRI, which showed a tear of her labrum. This is a side view, and we see that little area that the arrow is pointing at is a subtle looking tear. As a result of that, we tried a diagnostic injection where he injected numbing medication into the hip, and that temporarily relieved all of her symptoms. So from that, we knew that she had a labral tear and that it was the labral tear that was causing her pain. She ended up getting surgery, a hip arthroscopy, and here are some pictures from her surgery itself. If we take a look at the picture on the left, once we're in there, to the naked eye, that's not such a subtle tear. That looks abnormal. And so that was her labral tear with fraying of the labral cartilage, and it was torn off of the socket, like a gasket pulled off of the socket. On the right side is the labral repair. And so we use suture anchors, which is string screwed into the bone, and special instruments to pass that around the tear so we could tie it down. This next picture is one of the repaired labrum. So you notice there's no more fraying. The gasket is sutured down to the socket now. And on the right side is once we let off the traction on the table, so we allowed the ball to go back into the socket, we see the return of her gasket and suction seal around the ball. So next, we'll proceed to answering some questions. Let me see what we have. So this first question is, what's the typical recovery time frame for hip arthroscopy? And so it's relatively quick compared to most hip procedures and other procedures. So typically you're on crutches for a month after surgery. You start physical therapy a week after surgery and continue for 1 to 2 months. With my patients, I let you return to full activities, which includes all sports, at 3 months after surgery. Let's see. What's my next question? How can I prepare for surgery? And so in preparation for surgery, obviously we would want you to be seen by one of our hip arthroscopy experts so that they can better answer your questions and give you a realistic idea if you're a good candidate for hip arthroscopy, what the surgery and recovery entails, and how you'll end up doing afterwards. In terms of preparing for surgery, usually we just ask that you don't have anything to eat or drink starting at midnight before surgery, that we get your physical therapy arranged ahead of time so that we have a clear schedule moving forward after your surgery for your recovery. Let's see. After surgery, can a patient really expect to return the level of activity they experienced prior to their injury? Yes. And so my experience with hip arthroscopy is it's been a very reliable procedure to allowing people to return to their previous level of activity, especially in these acute injuries where people are seeing an injury where they twisted their hip, suffered a labral tear that caused their pain, and we're able to repair that labrum back down. After you heal up from about 3 months, people do pretty well. They're able to return to the same sports and other activities they were doing. What else? Can I still run long distance after surgery? The short answer is yes. And so by having surgery, once we get you through the appropriate rehab, after about 3 months, I turn you loose to be able to run again. Obviously, this is a gradual process, so you start at shorter distances, but as you build up the endurance and sort of build up your musculature, because you will be a little weaker than before after surgery, once you build things back up again, you should be able to return to your previous level of activity. Let's see. Are PRP or stem cells an option? If so, how long does it typically last? And so I personally do not administer PRP or stem cell injections. However, I have several partners in the practice that do. It was something I practiced in fellowship. It's something that is a reasonable option. Unfortunately, most insurances do not cover PRP and stem cell injections, so it's usually out of pocket. The research is still relatively new on these options. It seems to show that it is helpful with these types of injuries. However, we don't know exactly what mechanism it works through. And typically in terms of how long it lasts, that's varying. I've heard results from 3 months to up to 2 years after getting such an injection. And the data, we're still collecting on that. So the word's still out. Is this procedure covered by most insurances? The short answer is yes. And so typically, as part of a workup of a hip injury, you see a physician or a mid-level provider. Through our exam and history, we're able to diagnose your hip injury. It usually involves getting imaging like x-rays and MRIs to confirm your injury. Once you've gone through a trial of non-operative treatment, so physical therapy, anti-inflammatories, which in a lot of cases get people quite a bit better. If that doesn't get you better, then I think it's reasonable to suggest an arthroscopic hip surgery. And once you've been sort of through that process, most insurances do cover that. And finally, I have what activities lend themselves to more severe wear and tear on the hip. And so historically, these hip injuries, including femoroacetabular impingement, were most commonly seen in male athletes, hockey players, football players. However, we're finding an increasing amount of hip injuries in people of all levels, really, both male and female, no matter what athletic activity you do. These just twisting and pivoting motions can lead to subtle injuries in the hip that over time get worse. Great. If that's all the questions for now, then we'll wrap this up. Thank you so much for tuning in. I hope I was able to teach you a little more about hip injuries and hip arthroscopy. And please feel free to reach out or schedule an appointment with me anytime if you want to learn more, if you have hip pain, or if you want to ask any questions. Thanks again.